At age 50, a colonoscopy should be done, and that should be done roughly at 10-year intervals, depending on the findings. If there are polyps that are found at the time of colonoscopy, which are precancerous, then that interval may be shortened. If there's a family history of colon cancer, then that patient should have their initial screening colonoscopy typically 10 years earlier at age 40, and they should have their scopes at 5 years. So if a patient has any change in their bowel habits, for example, any abdominal pain, any rectal bleeding, any narrow stool, any black stool, those are all abnormal concerning findings. Now again, they all could be completely normal findings, but that should definitely warrant a consultation with their physician and referral for a colonoscopy. So colonoscopy, the prep is done the day before at home, and patients can work and do their normal day. The prep itself, the actual cleaning out, occurs at the end of the day when they're home from work. It lasts a few hours to clean them out. The patient's under sedation, so they're not awake and they don't feel or remember the procedure, so they'll need a driver the day of. And the procedure itself takes between 15 and 30 minutes. The recovery time that day, they're still in the hospital probably another 45 minutes or so until they're up and at them, the sedatives have worn off, they're able to keep some liquids and food down, and then they go about their day. We advise that they don't drive or work that day because of the sedatives, but they're essentially back to normal. The day following the procedure, they can do whatever they want, resume normal activities. A completely normal scope, how I do it is I'll tell the patient and family right then and there they're good for X number of years. If it's normal screening, they can come back in 10 years. They don't need a follow-up. If polyps are removed, it depends on the concern. How big are the polyps? How many are the polyps? If there's an issue where I want to talk to the patient when they're awake and not sedated, then I'll bring them back. If it's something that can be given over the phone or via letter, then we'll do that.